Science is not a problem. Access is the problem.
Welcome, Dr. Michael. He is a medical doctor, an educator, and a director in West Africa, who is a shareholder at 𝗪𝗵𝘃. He leads partnerships and implementation across diagnostic and public health initiatives in Africa. And beyond that, with a strong focus in early detection, equitable access, and practical solution that works in the real world. And we're so happy that he is the crowd favorite of our 2026 HealthTech Impact Award under the umbrella of Diagnostic and across all of our 6 categories. So cheers and congratulations for all the hard work that you have put forward in building and expressing your passion in bringing the right early diagnostic across multiple African countries.
The point is, point of care testing is easy with rapid tests. 10 minutes, max 15 minutes, you get your result. But let us look at a place where there's less access, okay? In a very remote environment, where transportation is a problem, where communication is a problem. Most of these people don't even have a mobile phone. The sky is big enough for all the birds to fly. So the sky is big enough for all of us to exist.
Welcome to Provider's Edge, where healthcare leaders and innovators learn how to scale smarter, lead stronger, and create lasting impact. At Healthcare Leaders, we often focus on building better solutions. But what happens when the people who need them most cannot access them? In today's episode, Dr. Chigozie challenged us to rethink the real barriers to better outcomes, which is access, not innovation. Whether you're running a practice or scaling a health, dental, or wellness ecosystem, you will learn why early diagnostics, practical implementation, and equitable access can determine whether your solution creates impact or gets left behind.
Thank you so much, Sabrina. That's a very warm welcome. Thank you very much.
Share with us, when you step into medicine, we know there are so many different subdivisions of medicine. What made you feel like public health is the sector that you wanted to go in, and particularly the early detection space?
Thank you so much, Sabrina, for that question. You see, before one make any decision, one thing that resonates perfectly is impact. What impact should I make? Earlier on, I had this passion for maternal and child health. Maybe because I lost a child, my first child passed away. But then I looked at the global perspective. How can we make impact? Impact that matters. Not just at policy level, but at the baseline level. Now, I thought about public health, I thought about diagnostics. Why? Early detection. It has always been my motto or my slogan that it should be screening, diagnosis, and treatment. Why? It's not because the science is not there. I'll be very honest with you. The science is not a problem. Access is the problem. Far too many times we've seen a lot of people present in the clinics, in the hospital, and the likes. They present late. Why? Remote area condition, no communication, and the likes, or delay screening methods or result feedback. So what do? I thought it twice. Okay, diagnostic is one thing we can make a global impact on, not just within our environment, but at a larger level. When somebody comes to the clinic, when somebody comes to the hospital, it's very easy to screen the person. And with the test kits that we have in diagnostics, as early as 10 minutes, the result is out. So that does a lot of wonders for us. That is it.
Yeah, so tell us a little bit more about your test kit. We know sending out lab testing can sometimes take hours and days. So these rapid testing become a very crucial. So what are the disease panels that you're able to test for that 10 minutes panel?
Okay, there are a whole lot of them, but most crucially, the one that has been on a global scale, especially for our multi-country study, is our HPV urine test and the 3-in-1 STI urine test. The 3-in-1 covers chlamydia, gonorrhea, and trichomonas. Now, there are lots of others. There are a whole lot of others. For example, the antenatal panel covers HIV, syphilis, hepatitis B, and hepatitis C, all four in one. Now, why is this important? Point of care testing has a whole lot of different levels. Okay, somebody comes to the clinic, it's easy. You do your testing, you're in. And why is this very, very important? Why are we so particular about this? Why? The reason is simple. It is non-invasive. Okay, let's use something like HPV, the pap smear and other gene expert method over there shows that you cannot get your result as early as 10 minutes. And most of these are not invasive. Now, my apologies to the female folks, Sabrina, but then nobody wants to just lay down and have their lady part open. Nobody wants that. If you can bypass that, if you can do something better than that, why not do that? Now, urine sample is something that anybody can agree to run the test because it is what? Non-invasive and it is faster. So if I approach you and say, okay, this test is going to go for this, it is easy for you to make an informed decision and agree at that point, get tested, diagnostics is done, and then the treatment pathway begins. That's it.
Right. So what you're talking about is that convenience of getting a testing not only is reducing the hassle, the pain of going to a physician's office, has to be the right people to be able to perform what we usually do, a pap smear or any other testing that you screen for STD, HPV, things like that. You guys have a way to do it much easier, and it's with the urine test that gets result faster. So then we are reducing the barrier of people don't even want to do the testing in the first place. And then say in a larger scale, population health-wise, we're reducing amount of people who are potentially at risk or already are having these STIs, and we can help to get them to treatment much faster. Or the people who doesn't, then at least they have a peace of mind so they can continue on with their lives. As you have been involved with many different hospital systems and multiple different countries in West Africa, what do you feel like is the number one thing that people say yes to? We do want these rapid testing versus what are the things people still hung up to say, is this something we wanted to do?
Okay, now if we look at the non-invasive nature of this, as I said earlier on, these make people to say yes, even at the point. Okay, now it is very unlikely for somebody to agree to a test that is invasive. If not for anyone, if not for anything, the informed consent has to take a whole lot of time. And then the feedback mechanism has to take time as well. I'll give you a practical example. For example, HPV. Most of the women who screen for HPV are women who are from the rural areas. In as much as we know that HPV is a global issue, it is no respecter of age, of sex, of financial status, wherever you are, you can get that. But we are looking at settings whereby our test kits work anywhere, be it in the most high-tech environment, be it in the most remote environment. The point is, point of care testing is easy with rapid tests. 10 minutes, max 15 minutes, you get your result. But let us look at a place where there's less access, okay? In a very remote environment, where transportation is a problem, where communication is a problem. Most of these people don't even have a mobile phone. The few who have a mobile phone don't even have electricity to charge their phones. So how do we continue the point of care after that first contact is a concern. So that's why we take advantage, we leverage that first contact to make sure that we are in the right path of screening, diagnosis, and treatment pathway. That way it becomes easy for them to have that care. That's the pathway.
Exactly. It's definitely about we see patients will see that as something easy they wanted to have. Now, we also know there is a difficulty in entry and access. And then what do you feel like that's where the difficulty lays? Is that the local health organization, is the country, is the whole health system wise? What do you feel like why certain countries are easier to adapt in these point of care versus other countries or geographically?
Okay, I would say is the access. Okay, now let me use a third world country and a first world country. Sabrina, you cannot compare. You cannot. For example, in the United States, the technological know-how is so advanced. Almost everybody in the US, pardon my exaggeration, but almost everybody, a greater percentage of people in the US have access to mobile phones, for instance. And electricity is hardly an issue. Okay, this is just one example of many. Now, let's use a third world country, any third world country. Okay, now the care system is there, although it is not to the highest level. But then, how do we now have access to these people that need the care is a concern. The problem, as I said before, is not the science. The science works. Our test kit works anywhere, any environment. But our concern is the access to the people who needs the care the most. So a first world country has the advancement. Okay, yes, this test will work. We can reach out to the patient when need be. But then what happens in the third world country where we cannot reach out to the patient for follow-up care? What do we do? So we are trying to make sure that such is actually being resolved as well.
Well, actually, both your third world and the first world country all have the similar problem when it comes to access to care to urban people who are outside the large cities. There are plenty of locations that you can drive for miles that there's no pharmacist and one doctor covering large system. So what I was asking you is why you feel like if really it's so easy for all the country to adopt it, then every single country should not have this issue, right? So what I'm also asking you is, since you are having the test kit, if it's so easy that every single person, every single facility should have this in no matter what type of environment, right? So what is it really about getting people to have the testing widespread right now? Use one of your country, for example.
Rephrase the last sentence. Let me understand. What is the issue with the I didn't get the question properly.
So if it's so easy to get people to do these testing,
Yes.
how come it's not completely done everywhere instantly?
Okay.
That's what I'm asking.
Okay.
Is that there is still a barrier to entry?
Yes, of course. Now, every country has a process. For example, regulation. Now, before any test kit, any pharmacological device, any drug, medication, be it IVDs, RDTs, are used, there must be a regulatory agency in that country that must approve the test product before they are being used. Yes, we are saying that this test kit works everywhere, but then there must be an entry into each country. And that is the sole reason of the validation study for the 16 multi-country study that we're doing. This is part of it. Now, let's say we want to go through this in America, for example, apart from the third world country. I understand that it has to go through the FDA.
What really stood out to me in this conversation with Dr. Chigozie is that the challenge isn't a lack of innovation. The challenge is access. We talked about why so many patients are still diagnosed too late, even when rapid diagnostic tools can deliver results in minutes. If you're building a healthcare solution, lead a practice, or improving patient outcome, this is a powerful reminder that creating great technology is only half of the battle. The real question is, how do we get it into the hands of the people who needs it? Before we jump into the rest of the conversation, I want to take a quick pause and share something that I would encourage you guys to apply. Are you a clinician, industry expert, or established founder shaping the future of longevity, women's health, mental well-being, and regenerative medicine? If you have proven expertise, meaningful results, or a health technology company generating at least $1 million in revenue, we would love to hear your perspective. Apply to be a featured speaker on Provider's Edge and share the insights other health leaders need to hear. Visit theprovidersedge.com to apply.
So the FDA must approve of the product before it's being used. It's unlike any other test product or anything else you just go to the market and buy and use. Yes, you can use that self-care, but the regulatory agency in any particular country must go through the product, certify that this product is safe for use before it will be used.
Right, exactly. So every single country have its own FDA.
Yes.
And so how long have you guys having the study? And then what are the results you're already being able to prove to this organization? It is safe and it's accurate to use.
Okay, now for the 16 countries that are on board with us, right now we are at the level of ethical approval. So we have a central protocol that each country should adapt to its own local context. Then Right now, at the moment, we're at the level of ethical approval. After ethical approval is done, before the implementation phase will roll out. That's where we are at the moment.
Awesome. And do you already have patients using the test kit before this major study to have at least early traction or data point that can that you have been submitting to each of the countries' regulatory body?
Yes, yes. Like in Asia, it has been used. In Southern and Eastern Africa, it's been used. So we are also trying to make sure that this test kit is used in other parts of Africa for the African people, for the African context. Let's say we want to go to a place like Latin America. Again, it has to be used there for the people of Latin America to experience such, and then we can say, okay, it works in this country. Yes, we have studies to say that, we have proof to say that these people have used it and it works there. We don't just want to base on, okay, it was used in this place and it works. Yes, we know it works. For example, irrespective of where you buy a phone, it does work. But we are saying that if this phone is produced here and we are saying it is from this manufacturer, it should work here. We bought it here, it has been tested here, validated here, and works here, especially in an African setting, which we are actually looking at full well.
Beautiful. Now, what is next for you guys? What do you think is the next time span or the big push until you guys start kicking off all the studies?
Okay, now we are looking at in the next 3 to 6 months, we should be able to move fully into proper execution, wrap up with the multi country study, and expand our partnership. This is one thing we are earnestly looking at, possibly in the next 6 months.
Amazing, right? Like 6 months can run really fast.
True.
So, what's the bigger picture and bigger goal at play for you guys?
All right. Well, the bigger picture is being able to scale not just for the 16 countries we're looking at. In fact, the good news is most countries have shown interest in being part of the study and our doors are open. So we are looking at the bigger picture being expanding not just in an African context, but beyond Africa, be it Latin America, be it in the Caribbean. This is one thing we are looking at. We are also looking at partnering with reputable individuals, organizations, institutions, and the likes. Because there is this analogy I always give, Sabrina. Now, when you do your hand, when you want to wash your hand, you cannot wash your hand by yourself, just like this one finger. No. But when you put two hands together, it becomes easy to wash your hand. What am I trying to say? There's no point of alarm for us to compete when we can collaborate. When we collaborate, we move faster, we get things done, and the impact is global.
Yeah, so that bring me to the next question. We actually have seen some fast round of rapid testing. Have you started looking into your competitors across the globe into who also have similar product services and how yours might be better, cheaper, faster?
Yes, we've actually looked at that. In terms of cost, we'll say that ours is really, really cheap. I must say, ours is cheap. One thing I also want to put out there is this: the sky is big enough for all the birds to fly. So the sky is big enough for all of us to exist. Now, for us, we there might be competitors, yes, okay, but then if we all are making global impact, if we all are doing the right thing in healthcare, and people are getting proper screening faster and easier, and they're getting proper diagnosis and treatment, I'm fine with that, Sabrina.
Exactly. It's about having a abundance mindset of that, even just from a production supply chain perspective, there are so many billions of people on the planet. It's not possible for any entity to cover everybody. So it's actually okay to share the science, share the technology, and for people who are in certain locations, certain region, to be able to serve that population. And then we talk about that with a lot of startup as well. Don't feel like that you already have strong competitors in the US. Well, if you have connections in Europe, in Asia, in Latin America, in Africa, start where you have the best connection. Grow from there. Serve the people that do not have those technology and start expanding and collaboration from there. And also at this flip side, don't try to go to too many regions, right? Be able to focus on something because every single country has a different regulatory body.
True.
It is hard if you have to go through the same process system over and over again. There's a time cost, there's money, there's people, right? We want it to be the fastest to adoption. If there's no adoption, there's no pilot, there's no study, there's no data, we cannot truly approve this thing is impactful. You're not solving a problem if we're still in this halo of hypothetical state, right? So it's all about, doesn't matter if you're pre-C, if you're C, you're just getting Series A, start having traction revenue. In every single phase, you need to have a clear plan of execution with the right people. And then the right capital would be injected because they see that, right? You're de-risking how your company is not just built on La La Land, and you actually are truly have a connection with the clinicians, with the patients, with the community, right? So it's about how clear you position yourself, and also be honest to say, yeah, so I have competitors. That's okay. Yes, I have a time frame of needing to get every single country to buy in, but we have some data from other region of Africa, Asia, right? It's about pooling other resources and doesn't always feel like, oh, I have to get myself approved to a pilot, then the capital will come in, or I have to get some cash coming in before I can even get to the pilot, right? It's never gonna be like a step. It has to everything work simultaneously and synchronistically. So I love your mindset of being always abundant, always open to learn more, and always knowing there's plenty to go around, and it is something that the patients definitely will want. Now it's about the government to really see that this is safe, this is good, and then we can get to the right people for the right access that they need. What would be your ask for the community? Well, we usually like to position this as, if you have a magic wand that grants you 3 wishes, what would you use the 3 wishes for?
Okay, spread the word, sensitize people, and let us collaborate together.
Awesome. Appreciate you. In the second part, I was inspired by how Dr. Chigozie moved beyond the technology itself and focusing on implementation. A rapid test only creates impact if people can actually reach it, trust it, and use it. We explored the reality of serving remote communities, the barrier that often go unseen, and why health leaders need to design solutions around the people, our patients' real-world experience, not just what works in the clinical setting. That shifts in thinking can change everything. Now, for all the visionaries out there who have a great idea, a startup or innovation that could change how we perceive health, dental, and wellness, bring it to hot or not. You get to have 2 minutes to pitch your idea in front of investors, clinicians, operators, founders, and industry experts. Then the audience weighs in. Is it hot? A solution the market wants? Or not? A concept that needs more validation? Formerly known as pitch to yes. This is your opportunity to pressure test your message, get real feedback, and potentially connect with partners, customers, and investors. Submit your pitch at pitchtoyes.com and join us for this virtual event. Because great ideas deserve honest feedback. That's how you can accelerate faster. And then what's the best place for people to connect with you when they are also very excited about supporting the West African countries in getting rapid testings?
Okay, the connection could be on LinkedIn. My name, Dr. Chigozie 𝐬𝐿𝐻𝑒𝐿, that's my LinkedIn contact, or via email, drmichael@xerifiedhealth.com. Just a quick addition there. It's a Pan-African diagnostic company, not just in West Africa, but across. My partners are predominantly based in South Africa and Zimbabwe. Okay, I am the one on the western side of Africa. So it's all across Africa, not just on the West.
Awesome. We're so excited for you. Congratulations again for being the crowd favor for the Diagnostic Impact Award, and looking forward to all the many great stuff to come for you. Until next time.
Thank you so much, Sabrina. Thank you. I appreciate it.
Today's interview reminds us that breakthrough healthcare innovation means very little if people who need it cannot access it. Dr. Chigozie challenged us to look beyond the science and focus on the real-world barriers that delay diagnosis, limit care, and widen health disparity in all countries across. Whether you're leading a practice, building a healthcare technology company, or creating new wellness solutions, This discussion highlights why implementation, accessibility, and early detection are just as important as the innovation itself. Here are the 5 key takeaways. Number 1, access, not innovation, is often the biggest healthcare barrier. Dr. Chigozie emphasized that many life-saving diagnostic tools already exist. The challenge is ensuring they reach the people who need them most, especially in underserved and remote communities. Number 2, early detection challenge outcomes. Rapid diagnostic can provide results within minutes, allowing healthcare providers to identify diseases earlier and intervene before conditions become more severe and costly to treat. Number 3, healthcare solution must be designed for real-world conditions. A solution that works in a hospital might not work in rural village. Successful health innovations require understanding transportation challenges, communication barriers, infrastructure limitations, and patient behaviors. Number 4, public health impact requires thinking beyond individual patient, rather than focusing on treatment. Health leaders must consider population-level strategies that improves prevention, screening, and early intervention at scale. Number 5, the value of health innovation is determined by adoption. No matter how advanced a technology is, it creates little impact if patients cannot access it, providers cannot implement it, or communities do not trust it. Accessibility and implementation are just as important as innovation. If this conversation got you thinking about what happens after a diagnostic solution reaches the healthcare system, I have another episode for you. Check out How Diagnostic plus Payers Speed Treatment with Dr. Julie Schultz, where we explore how diagnostic companies, clinicians, and payers can work together to reduce treatment delays by better aligning workflows, incentives, communication, and responsibility. You'll find the link in the show notes below. Thank you for listening. Remember, the positive change we're seeking starts right here with me and you. If you are a fan of the show, or if you are just having struggles or success that you're either experienced in the past or are experiencing now in the healthcare industry, these matter to all of us. I want to hear from you. Visit sabrinarumback.com/connect and send me a direct message. Talk soon.